Middlesex London.
Thank you, Speaker. Speaker, my question is to the Minister of Health and Long-Term Care. Minister, the government's rationing of health care has created a crisis in Ontario. Last week in London, 22 mental health patients were left waiting for beds. They were placed in a classroom because there was no space. Guelph's emergency room was shut down when 11 mental health patients required inpatient admission, but the hospital had nowhere to place them. Minister, mental health patients deserve the same care as physical health patients. Why are you failing our mentally ill across this province by failing to deal with the crisis in our healthcare system today? Minister, will you stand up and stop rationing the healthcare system?
Thank you. Minister of Health, Long-Term Care.
Well, Mr. Speaker, I'm not exactly sure how a $1 billion new investment in our healthcare system can be described as anything at all in relationship to what the member opposite is alleging.
Very good news.
And I think he was in the legislature last week when we talked about the situation in London, where I reminded the members of the legislature of the new investment of more than $1 million, included on capital as well as an operating budget as well, to develop a brand new crisis centre for mental health patients in London and in the Middlesex area. Mr. Speaker, we're continuing to make these important investments. I would hope that the member again acknowledge that often it is in the community with strong community support where the best outcomes are achieved. It's not necessarily in the hospital.
Yep. Thank you. Supplementary.
Speaker, back to the minister. Minister, I was here last week when your government turned your back on everybody suffering from rare diseases. Minister, Speaker, the situation worsened over the weekend. Pete Verburn, who suffers from Alzheimer's, spent 8 nights sleeping on the Victoria Hospital floor while in restraints because there are no beds enough frontline healthcare professionals to look after him. Your government has had many photo ops promoting mental health support, but the government is failing terribly. The healthcare system is being rationed because of your government's financial mismanagement. Over $2 billion have been wasted on e-health, $26.9 million on a diabetes registry, and billions more on Orange. Could you only think of the mental health services we could have in our province if you hadn't wasted that money? Minister, will you stop the waste and rationing and look after our most vulnerable that are slipping through the cracks of your mismanaged healthcare system?
Minister of Health.
Well, Mr. Speaker, the $1 billion increase to our healthcare system includes many important investments, whether they be in palliative care and hospice care, whether they be in mental health, an additional multi-million-dollar investment in mental health services in this province, whether they be the capital investments of $12 billion over the next 10 years. But, Mr. Speaker, we've had an independent study by ISIS which has shown that the reforms that we're making are having a positive impact. A shorter length of stay in hospital, increased numbers of patients treated, minimal impact on readmission rates, and, importantly, a statistically significant reduction in nurse-sensitive adverse events. That's important because that's about the safety of our frontline healthcare workers, and the evidence shows that our reforms, our transformation, our quality agenda over the past few years is making an important and positive impact.
Yep.